Delirium is very different to dementia. It's actually what we call an acute condition, which means it's usually sudden onset. It's reversible, whereas dementia is a progressive illness and usually progresses and gets worse over time. Delirium, the symptoms can look similar and can often present the same as somebody with a dementia, but it is reversible, and if we identify it, we can reverse it.
All sorts of things can cause an episode of delirium, and I think the important thing to remember is that anybody will become delirious with a sufficient enough insult to their brain. So particularly then when your brain is more vulnerable through being elderly, having lots of things wrong with you medically, having illnesses such as dementia will then make you very much more vulnerable with even a small insult like an episode of constipation or simply changes in your medication. So delirium is also called something called an acute confusional state. So what that means is that it's something that comes on acutely or suddenly. It's a fluctuating condition. Other features that we would also see would be alterations in alertness, attention and arousal, so somebody's ability to function and focus to attention and sustain their concentration, also their level of wakefulness, and that may range from being very underactive and sleepy through to being very aroused, overactive and what we would call hyperactive. Also changes in memory and thinking, and that may include disorientation or short-term memory loss, and sometimes a distorted sense of reality, so that would include what we would call delusions and hallucinations, or seeing or hearing or even feeling and smelling things that aren't actually there. So it's really important that people have confidence in their ability to recognise that their relative is different, that there's something new and something different about them, and it might be something very subtle and nuanced that other people wouldn't otherwise pick up. We would encourage them to raise that with any involved health professional, for example, if there happens to be a district nurse that's involved in that person's care, but if not, to be making sure that they're accessing help either through 111 or their GP. It's important to point out that some causes of delirium can be very readily and simply managed in the home setting. It doesn't ordinarily mean that that person's going to need to come to hospital. Hugely, and we're understanding more and more, particularly with older people, that they're presenting not with the classical features of COVID that we've heard about in the news, but with features consistent with a delirium. So it's really important that we're seeing those people, because it's only upon presentation to health settings that we're recognising that actually there's underlying COVID infection. And there's something very different too about the nature of a COVID delirium that we have seen and that we're beginning to understand how to manage best.